She had a childhood injury going back at least 15 years or so ago. And ever since then, she noticed that she had a hump appear on her nose. She was completely restricted in her airflow, particularly on the left-hand side. So she came to me asking whether or not her septum could be corrected, straightened, so that she could breathe more symmetrically, but at the same time, could the hump be taken down as well? She also explained to me she didn't like her nasal tip, the fact that it was a little bit too droopy and looked somewhat asymmetric, particularly at the base of her nose. And if you have a look at these photographs of the nasal tip, you can see how broad the area at the base of her nose is. We refer to that as the medial crural foot plate. If we have a look at the side profile here, the lateral views, see how she's got quite a prominent dorsal hump and also quite droopy nasal tip. She's got quite thick skin, and when I was palpating or examining and pressing the skin, you can see that there was very little support, particularly at the nasal tip area. If we fast forward now, 3 months following the surgery, here you can see the nasal hump has been taken down quite nicely. She's got a more natural looking appearance, and she was very clear to me, I don't want a ski slope nose. And that's what I think we've been able to deliver. Looking at the base of her nose, nostrils have become far more symmetric. That medial crural foot plate, which was prominent at the base of her nose, has all been taken in. And I think you'll agree that she has a lovely, more symmetric nasal tip.